Thank you for the opportunity to be here today to speak on behalf of this legislation. And I'll just read my testimony. I don't know if you got a copy of it. I did get it in this morning. 2 years ago, I was contacted by a friend whose son's doctor shared the paperwork challenges he and the other doctors have with yearly health forms. Since I submitted this bill last session, I heard from many more doctors and still even more parents who support the idea of a single form. Every year, parents drop forms from numerous camps, activities, sports, daycare centers, all requiring the basic information needed: immunizations, any health problems, allergies. However, each organization has a different format for their form. Some doctors charge a fee to fill out multiple forms, as it takes a lot of time away from their administrative staff's time. It's also a burden for parents who need to continually visit the doctor's office to drop and pick up health forms for every activity. Connecticut should work with the doctors and organizations to produce a universal health form for all activities located in our state's borders, and simply modify the form that our public schools use now. I'm hopeful the committee will agree to pass a bill that will direct the Department of Public Health to work with doctors and organizations to produce a universal health care form. And if I could, we have a large pediatric practice in our town that serves Fairfield, Trumbull, Monroe, Stratford, Shelton, a large area. And one of the doctors submitted testimony to me late last night, which I had my aide give to the clerk, but you might not have it. And he says, this is from Dr. Thomas Homa, from Fairfield Pediatrics Associates, and he says, this letter is to voice my support for Bill HB 5146, which would require the use of a public school assessment form by youth camps and daycare facilities. As a practicing pediatrician in Connecticut for the past 12 years, my colleagues and I have been frustrated with the variety of different health forms required by schools, daycare facilities, sports camps, youth organizations. Each form requires different information, some from simple and some are complex. Our practice has spent countless hours that are wasted gathering specific information for different forms. This leads to less time for our support staff, nurses, and doctors to do their jobs, which ultimately means less time with their patients. This process all leads to frustrated parents, patients, and doctors who have to wait long periods for completion of forms. For years, doctors have wished for a single, simple, standard health form that could be used for all entities that require a health form. This legislation not only makes sense, but will decrease costs and increase satisfaction for our healthcare system. And he says thank you for your consideration in this matter.
Thank you, Representative.